audience. This is Sinder, and we're here again today with another fascinating episode with Care Therapy and the Savvy Caregivers. And we have the pleasure today of speaking with the wonderful Dr. William Wilson, who for over 20 years has practiced chiropractic medicine in our city. I believe it's the city of New Orleans, doing marvelous things. I heard about him before I met him. I love him for his passion and his approach to holistic medication. So we just want to open up. We want to listen closely today. Questions that we may have, we ask you to chime in, to connect with us, of course, on Facebook and on Instagram and our website, which is caretherapy.online. And we are going to have Dr. Wilson back again to answer some of those questions. But today, we just want to honor and welcome Dr. William Wilson here to the show. Thank you so much for being with us today, Dr. Wilson.
Thank you, and thank you for that fantastic introduction.
Awesome. Before you came in, before we started the show, actually, you've shared so much information. I've learned so much in the last 15 minutes, and we just want you to just take the show and begin to teach our audience, because our audience is one that is comprised of caregivers and seniors, okay, which are baby boomers most of the time, or baby boomers and beyond. And so
Which I'm a part of.
which you're a part of, yes. And so you know the journey, you know the experience firsthand. But we want to stay young. We want to stay vital. We want to stay vibrant. And and I know as a baby boomer that, there's certain procedures and processes and things that are taking place in our lives that, may cause the downside of, physical functioning and having quality of life. And so that's why it's our desire to bring great information to our show so that we can instill it, we can operate in it, and we can move forward in our lives as we're taking care of our seniors. So we want to start the show with you telling us a little bit about yourself. I know you've got a lot, you can tell, but, but tell us a little bit about yourself and your background in medicine.
Well, I started out actually doing herbs and nutrition. I had a mentor who was named Brother Larry, and he was real into natural health care, and he was real into nutrition. He was a what was what's being called now veganism, but he and ultimately myself, we were vegans before they had the word vegan.
Okay.
And so that was my beginning and my basis. And from there, subsequently, I started to examine and do research in terms of health books. An important book, and one of the first books I read was by Dr. Jethro Kloss, who was Back to Eden. Early herbal, what I would call an herbal guide. For the 1930s, he addressed a lot of different conditions and put forth the herbal formulas to address those conditions. So that also was some of my beginnings and some of the basis of my thinking, and it has progressed from there. And it really accelerated once I was in chiropractic college, because there were just, I mean, it was great because there were people that were just into different aspects of natural health and natural health care, and from different vantage points. So I learned a lot, and the curriculum itself taught us a whole lot. So um, that's sort of maybe what are we talking about? 8 to 10 years and compressed there, but it was a lot involved in the whole process to get me to the point of graduating and being able to step out and do a practice.
Wow, that's awesome. I had always heard, of course, we hear about chiropractic care, chiropractic medication, and the adjustments. I think you guys are famous for adjustments. But I had never experienced it until I had my own personal experience with the procedure. I had a knee procedure done because I was always very active and in sports, and I tore my knee and I had to have a procedure done. And it was such a traumatic experience for me that even after the procedure, I didn't want to move because the pain, I was afraid of the pain. I was afraid of the pain. I had over time, I had to learn to embrace the pain. That's really where my healing began when I made up my mind, I'm going to embrace this pain. This pain is my friend. Now, this is after the procedure. But then because I wasn't as active as I had always been, I was afraid to move, use my limbs. And you know, it happens when we're sedentary. Um, I needed something. I didn't know what it was. And I began to go into prayer about my healing. And then it came to me chiropractic care. And that's how I connected with your colleague, Dr. Tammy. And from that point on, I mean, my healing began, my limbs strengthened. She taught me how to walk. She taught me how to sit. She taught me how to get in and out of the car, you know. And then she also taught me about the nutritional component. And so, in addressing our community and our viewership that's in that baby boomer age and older, I would like for you to address that and how you feel that chiropractic care is a great benefit to us, and talk a little bit about the adjustments and the alignments of the spine, because she even showed me a picture of my spine and how over time, like everything does, gravity and the wear and tear affects your body. And that's how we can tell the difference in, you know, our movement and the way we walk and the way we move. Can you talk a little bit about that?
Yeah, that's a lot.
It's a lot.
That's
See,
it's
I
really
know
a lot.
things.
Yeah. Uh, well, I would start off by saying that it really boils down to a philosophical issue of health, okay, and understanding of a basis of health. And I would say that the basis of health really is two things: the spine and the stomach. So it's the spinal
Wow.
care and nutritional care. That's the whole basis of health, particularly for us, and particularly in holistic healthcare.
Okay.
So we have to look at the nutritional aspects, and we have to look at the structure. You um, and in terms of adjustments, yes, adjustments. We address the structure of what's called the musculoskeletal system. Which are the articulations of the spine and everything that attaches to it. Um, and the greater implications are that of the nerve flow, okay, because what emanates from the spine are the nerves that go to every part of the body. So that's a greater implication of chiropractic. Um, Beyond neck and back pain, which is good in and of itself. But beyond
Mhm.
that, we have the nerves that exit the spine and innervate every organ and cell in the body. So we potentially can have effect on some of these things, which is not greatly understood. But we see these things in our offices that are not generally known by the public in terms of many conditions that respond to chiropractic.
Awesome. Awesome.
And an adjustment itself is it's a little hard to describe in words. And now we have YouTube and a number of doctors that are
Right.
doing
Yeah.
it. Yeah,
YouTube
and
doctors.
I think that does scare some people
Yes.
because they're almost like Hollywood and over dramatic.
Okay.
But I can say this: there are multiple techniques, and this is not known either because we cannot advertise techniques. And I understand the reason for that. That would probably be a war.
Yes.
And they'll want to get into my techniques better, your technique, and all that. But I
Hmm.
would say that they all work, but particularly for older people, I would lean towards more of the what's known as the non-force techniques.
Okay.
Okay, and
Explain that.
um, there's such a thing as high amplitude, high velocity adjustments. Those are ones that you see um, many times on YouTubes, and those are the ones that you see even in the movies. There
Hmm.
was a movie that really dramatically illustrated it called Jacob's Ladder,
Okay.
which was a very it was a pro chiropractic movie. But it involves utilizing a hand and a thrust, and that's where the so-called quote unquote cracking comes from,
Wow.
which is poorly understood. That's really not your bone cracking. We think that, honestly, they really don't know what that is.
Oh my.
They think that it is a gas is released from the joint space, just like when cracking your knuckles, so to speak.
Mhm.
That's what they think the sound is. But for some people, and even myself, before I understood and knew exactly what it was, that can be frightening because a bone that cracks breaks.
Yes.
Right. So,
Yes.
yeah. So, I mean, that's what you're going to think of, but that's
Right.
not what we're doing. We're not popping and cracking bones. That's not what chiropractic is. The sound happens, but the whole goal there is to move the vertebra into a proper position that has been misaligned and causing dysfunction. That's the goal. The goal is moving the vertebra properly and moving the right vertebra at the right time, depending on what the body is telling us when we're reading it.
Right.
Okay. So that's the goal there. The pop is incidental, but with the non-force techniques, it's low amplitude, low velocity, and very little force that's involved.
Right.
And I mean, there's a technique called SOT, which stands for sacral occipital technique, which utilizes blocks under the pelvis that utilize your weight and gravity to make a correction.
Okay.
Very effective technique.
Wow.
You know?
Wow.
There's handheld instruments also that deliver a very specific and quick thrust. I mean, and it's so fast that it needs less force.
Yes.
And
Allow me to ask you this, excuse me, allow me to ask you this. For caregivers and seniors who are in the home, okay, we're talking about caregivers, we're talking about individuals who can't always get out, to the doctor or to the chiropractor to take care of themselves, but they're in the home and they're lifting and they're pulling and, and they're actually declining. I mean, the numbers show that caregivers oftentimes are more um are sicker than the ones that they're caring for, and thusly they pass away. Many do. Um, and you mentioned YouTube and the YouTube doctors, chiropractic doctors. What techniques and treatments would you recommend for those who are in the home who either can't get out to the doctor or can't afford, don't have the insurance or the monies to pay for chiropractic services? What would you recommend?
the caregivers or the patients they're taking care
Let's
of.
talk about caregivers. Yes.
Okay. That's a little hard. That's a little hard. Some doctors do, some dedicated doctors do house calls. I kind of understand why they're not doing it
Mhm.
anymore.
Yeah.
It's
But
kind of
are there
difficult.
any treatments or exercises? Do you recommend YouTube? Chiropractic doctors or
Well, the thing is with chiropractic, you have to. It's an in-person thing. You have to either go in the office or the doctor has to come to you.
okay.
And there's some doctors that will come to you.
Yes.
And
Yes. More and more.
yeah, so
Yeah.
and maybe we're getting back to that.
Yeah.
But
House calls.
yeah, but I mean, it's just better in the office and the clinical environment because all your things are there. You can't
Right.
just pick your office up
Yeah.
and put it in somebody's house.
Right.
That would be great if we could do that.
Yes.
But our instruments are there. Our diagnostic procedures are there. The therapy units are there. So that's why it's and we have to see you wherever it is. We have to see you.
Right.
It'd be great if I could put adjustments in a bottle and say and give you 24 of those and say you take one of these a day for the next month and come back and see me. That would be the ideal thing.
Yeah.
But unfortunately or fortunately, it's done by hand and it's a personal touch.
Absolutely.
Yeah.
So we're hopeful that we will have more techniques or doctors that can go into the home to provide these services. I know that there are some, and we are really moving towards what we can doctors in the home coming home visits.
Mhm.
There are more and more of those taking
House
place.
calls.
House
That's
call,
what I'm trying to
house
think.
calls, house calls. There are some new organizations and clinics in the community that are,
Doing
making the house calls. So we're hopeful for that, so that our caregivers and seniors can get the care when they can't get to the doctor.
I would say beyond that, though, what they can do is, I get a lot of people that are injured from lifting people,
Yes,
and
yes,
a lot of nurses. I've treated a lot of nurses
yes,
that's injured from that. I mean, a person is an awkward lift already and heavy.
yes.
So, if my understanding that there are lifts now that they use to do that,
Yes.
and I would definitely recommend that. I would recommend people that are doing caregiving. I would recommend that they use a back brace,
Mhm.
especially when they're going to
That's
lift
good.
anything.
Yes.
Okay,
Yes.
and learn the proper lifting procedures.
Absolutely.
That would go a long way in terms of helping to prevent some of these things. Because the tendency is just to bend over and grab it,
Yes.
and that's not how you lift.
Yes.
You're
And
asking for an injury
yeah,
then.
I love that. So you said Hoyer lifts. Those are the devices that can be used to lift and to turn.
Mhm.
Also, the processes of bending and how to bend and how
How
to
to lift.
turn. Use body mechanics
Right.
so that we won't harm ourselves. That's wonderful. One of the things that we're doing with our organization is brand new. We're doing a school. We're doing training. We're going to do training for caregivers to teach them how to,
Wow.
yeah, move in the home, how to take care of themselves so that they can sustain their life and thusly take care of their loved ones.
Mhm.
So that's very powerful. Talk a little bit about the difference in osteoporosis and arthritis.
Yes. Uh, One, like I was saying before when we were talking, arthritis, that's a whole group of diseases called arthritis. You have various forms of arthritis, psoriatic arthritis, osteoarthritis, rheumatoid, which probably the people are most familiar with. That's the one that causes the curving of the joints. Okay,
Mm.
so there's even gouty arthritis
Hmm.
that pretty much destroys the joints. So they're different. That's a whole classification of diseases and would need to be addressed from a holistic perspective in different matters and different ways, depending on the patient history and their current diagnosis. So arthritis are more of a stiffening of the joints and also the the wearing a way of the joints themselves and pretty much the somewhat the adding of bone, the ones that are not that do not cause the destruction of bones,
Hmm.
whereas osteoporosis is very specific um, in terms of what's happening, and what's happening there is that the bones are becoming the matrix of the bone itself is becoming thinner and weaker and lends the person more prone to fracture, and it's manifested on X-ray in what's called the medical term of rarefaction, which is means a pretty much a wasting away of the bone matrix.
Yes.
So those are the two different things in terms of the differences between arthritis and osteoporosis.
Right.
Okay.
Yes. Let's talk about replacements.
Mhm.
We talked a little bit about that before this show, the hip replacements and the knee replacements. And what are your thoughts on that? We know that it's a line that, you don't want to cross, over into the medical, but can you give us recommendations on how we should move forward if it's recommended that perhaps we're in the phase where those replacements are needed?
You're correct. I almost blurted something out that I would regret. Which I'm
True.
not going to say that. But I can't. What I can say, how we usually address this, is that I wouldn't do it myself right off. It would be my absolute 100% last option, um, because as I was speaking before, it's creating an artificial construct. And it's just like even with back surgery, it's a similar thing. You're setting up something there that's going to have an impact on a person's life, like you experience in the future. So it's just not that thing.
Mhm.
I mean, I guess it seems convenient and easy. If something hurts, or as a problem, just cut it out, so to speak, and
Yeah.
put something else in.
Right.
But as I was saying before, also, we are more than just a sum total of our parts. And
Oh,
what we learn in
love it.
chiropractic is that there's a spirit in the
Love it.
body,
Yeah.
and that is connected to a greater spirit, that goes beyond just the parts. And the human body is not a car that you can take a part out, the carburetor out, and replace it, or the transmission and replace it. It's just more to it than that. And I think they're ultimately going to find that out. And then you have the whole problem that you ran into of the drug treatment as a
Yes.
result of that, and then you
Yes.
got the problem with the side effects of the drugs themselves, and you need drugs for those side effects. It becomes a snowball rolling down the hill,
Absolutely.
and unfortunately, um, so I would say that what I would recommend is everything natural first. We have a saying in chiropractic, and that saying goes like this: natural healthcare and chiropractic first, drugs second, and surgery third, if at all.
Yes.
That's in terms of our thinking. That's a proper order and procedure of those
Yes.
things.
Yes.
I mean, you can, and unless it's, I mean, there are very different. I mean, there are different scenarios. Sometimes there's a medical emergency that will require surgery. If I have someone that comes in that's, as an example, that's had a fall straight in the sitting position and it's damaged the tailbone, and they have certain clinical signs and symptoms, that's a medical emergency because there's a group of nerves there.
Mm-hmm.
And that particular fall can cause what's called caudal equino syndrome. Okay, and that's a medical emergency, many times requiring surgery. So, as I spoke before, I've gained from being a professional and going through a professional program a lot more common sense approach to things, and not make snap judgments, or completely condemn something.
Yeah.
So I would say try everything natural first, and then, if necessary, do the drugs. Um, and I would starve off surgery myself personally,
Yes.
as long as possible. I probably wouldn't do it.
Yes.
Um, and you have to be concerned about the scar tissue that builds up afterwards.
Yes.
The body's
Correct.
rejection of that, because I mean, we're not meant to have metal in our bodies. Do we have any metal in our bodies? you know, so I mean, it works for some people, seemingly. I have a question about the long-term effects.
Yes, yes. What
But
I love about chiropractic care that is that it's almost spiritual. I guess that comes from
well,
the
there's a
holistic approach
and
of it.
there's a component of it.
Yes, a component. Yes.
There's a component. What I said, that greater thing, they call that in chiropractic universal intelligence.
My goodness,
That's what
it's
they call it.
amazing. It's amazing. As we close, come down to a close, I'd like to talk about something that's so important to caregivers and seniors, and that's fall prevention. What are your thoughts? How is it? How can chiropractic care and the strengthening of our spine and our bones, along with the training that we talked about, lifting and turning and moving, how can that help us to prevent falls, which can be devastating in the lives of seniors?
Yeah, we have what's called 3 phases of care: the acute, the beginning phase, the correction phase, and the rehab phase. The first goal, of course, is to get the person out of acute pain. So, related to that question, the next phase is correction. Um, and the last phase is rehab, which is correcting the posture. That will help in terms
Yeah.
of, balance. Balance in the spine helps in terms of balance, particularly at the top of the neck, what we call C1. Okay, which is closest we would get to the brain stem and the inner ear mechanism where the balance thing is, or the balance
Yeah.
mechanism is.
Yes.
So we would definitely look at and take good care of that area.
Hmm.
Um, and beyond that, the rehab part, like I say, strengthens also. and that will help in terms of muscle coordination, you know. So all these things go into
Work together.
that,
Work together.
balance. And
Something that is so important, and I work on consistently, I promise you, if I'm awake, I'm working on it because I'm not good at it. Posture.
Mhm.
Posture is so important, and it's a consistent practice. I don't know if it's natural with some people and others have to work on it, but it's important. Address posture and how that can affect. Because Dr. Tammy, your good friend, is my chiropractic doctor.
Mhm.
And she mentioned to me one day, she called me. This is how in tune she is with her patients, and I'm sure you're the same way. And she called me and she said, I saw a picture of you on Facebook. You need to come in for an adjustment. I can tell you need to come in just from seeing the picture of me and the unalignment of my body. You need to get here. Can you address that for us?
Yeah, posture is real important, and what we look at their structure, you know.
Mhm.
I can actually look at someone walking, almost tell them what's wrong in their back, but that comes with experience
Okay.
because we're taught to look at balance and imbalances,
Yeah.
like an unlevel pelvis. You know, I'm amazed too, medical students, I didn't know they were medical students. They were walking in front of me. I was actually going to Whole Foods, and I caught up to them and started talking to them. And I was telling them, one of them, like, you have a back problem, don't you? You know, and you have a low back problem. I can tell you exactly what's wrong with you. And they were looking at me with amazement, like, how you know that?
I know, because I
That's
thought I was looking good. And
mhm,
she called me and said, you need to get in here as
right,
soon as you can. It's amazing.
yeah.
It's amazing.
So we're taught to look for imbalances, you know.
Thank you so much. We're going to have you back because this has been awesome. And I am just so hopeful that our viewers are watching and those connected to us are watching and that they have learned and have gleaned. How can we get in contact with you, Dr. Wilson?
You can call my office number, which I have not memorized. You
Okay,
can
let's
tell me
see here
that.
together. We're
That's
going to get this. 504-827-1060.
that's
Does that
correct.
sound right?
Hmm.
Dr. William H. Wilson
And
Jr.,
it's total body chiropractic.
Total Body
That's on
Chiropractic,
71 Holmes Boulevard,
71 Holmes Boulevard, and that is in Tarrytown.
Tarrytown. Yeah.
Thank you so much. It's been an honor.
Thank you.
It's been a
It's
blessing.
been my pleasure.
You're going to be a good friend to us and to our community. So you guys, we ask you to please give Dr. Wilson a call or connect with us. Care Therapy, you can always give us a call. I'm Cinder, of course, 504-782-4629, or go to caretherapy.online. God bless you, and we look forward to seeing you next week. Thank you, Dr. Wilson.
Thank you.
Blessings.